police placement project came about as an idea to do 2-week placements for the police with Sheffield Health and Social Care and Mental Health Trust. On the actual 2-week placements, it varied a lot what the police officers would be doing. For example, if a police officer had their placement on one of the acute psychiatric wards, they'd hopefully be spending time with kind of different members of staff to see how those roles operate, to basically enable their understanding of mental health.
I work for the Community Enhancing Recovery team, so when they're with our team, they can go out with service users to their homes, they might go out shopping with them and have those conversations with service users about, what they've done in the past, what they're doing now, how their lives have changed. And there's also going to the multidisciplinary team meetings, spending time on the acute wards. There's lots of different things that they are able to do when they're on police placements.
When they come onto the ward, I encourage them to be part of the activities that go on the ward, which is sometimes just sitting and chatting with people, watching TV, listening to music. And so part of the induction will be us encouraging them to ask questions, so learn that way through getting to know them.
We've had a lot of feedback from service users within the trust to say that it's really great for them to actually be able to speak to police officers outside of their uniform, and I think for service users to have that chance to talk to police officers, I think that's provided a real benefit for our service users and for the police officers involved as well.
As a police officer, we very rarely get to see people when they're not in crisis as we respond to emergencies. To have an exposure to people who'd been in that position of crisis and they'd gone into mental health care, and to see them at the other end of that journey towards their rehabilitation and being reintroduced to communities following periods of extreme mental health trauma. It was very interesting, and they were often very eloquent and elaborate on how their experiences of police had been.
I found the police placement officers really did help me, because I could see the fact that when I was very ill, I didn't know I was ill. So I noticed the fact that police actually took me to a place of safety instead of arresting me. It's kind of really reassuring and really put me at ease.
We've had an amazing service user involved from the very beginning in producing this police placement project and producing the schemes. That's been amazing to make sure we were kind of pitching things at the right level.
So my involvement at the beginning is in the induction day. Generally the police have really engaged with it, and I've made sure that it's a thing where they can ask the questions that they've always wanted to ask, but maybe not being in the situation where they've been able to ask because people have been too distressed. And in terms of actually the impact it's having, because of the mental health difficulties I still experience now, I do still come into contact with the police, sometimes for slightly different reasons. And I have seen a difference, I really have.
I guess my hope for the future is that this scheme will be rolled out. I think the benefits that we're seeing already in terms of joint working within Sheffield, we need to see that much more widely.
For me, I think it's quite a big dream, but if all police officers in the future, that this could be a mandatory part of their training and their experience, so that they have a full awareness of mental health in all its different forms.
So I can be having a really bad day, it's a police placement day, so I've got the training bit that I do, and I go in and I come out every single time feeling better, feeling like I'm making a difference, because I'm giving someone a kind of unique perspective that is going to help them in their job, that then is going to help other people. So it feels really good to be a part of.